just received in our and further details of this continuing story. Just received in our this is the latest dispatch just received in our news.
Hello, and welcome to the Clapback. No, it's not a show about revenge gonorrhea. Unlike other shows that talk about the news, we talk to the news and clap back at it because, sometimes the news just don't know how to act. Now, we couldn't do a show without clapping back at the number one topic of conversation. Coronavirus, COVID-19, the real nigga flu. The cooties that got everybody cooped up in the house like they're in the 8th grade and got a D on their report card. By the way, am I the only one who doesn't quite know what day of the week it is? It's like, I feel like I need to start marking it on the walls like they do in solitary confinement. Or when Tom Hanks was stuck on that island in Castaway, it could be Tuesday, it could be Friday, I have no idea. If I woke up tomorrow morning and you told me it was Christmas, how would I know? I live in Alabama where it's 80 degrees 2 out of 3 Christmases. But in Alabama, it's always a white Christmas. Which brings us to today's first topic, the Make America Sick Again movement, or as I call it, MASA. This week, protests erupted in mostly red states when angry white people sauntered out of their suburban domiciles to protest Democratic governors who issued oppressive stay-at-home orders meant to keep people from dying.
Tonight, fresh anger rippling across the country.
I need my job. I need to work.
From coast to coast, thousands of people frustrated.
We're not going to have a vaccine for at least 18 months. We cannot shut down our state for 18 months.
About their economic survival in the face of widespread shutdowns.
That's right. The same overwhelmingly Caucasian group involved in the pro-life movement, the people who usually believe in states' rights, the same people who call Black Lives Matter a dangerous terrorist movement. Those people are now saying, yeah, all lives matter, but my bank account though. And if you think this is a spontaneous outburst of caucasity, White House advisor Stephen Moore, during a Zoom meeting with the Libertarian group, the almost alt-right free market conservatives who ain't shit but Republicans in flannel shirts, Stephen Moore told these people this.
In Ohio, we saw more protests today. I'm working with a group in Wisconsin that wants to do a drive-in. So, you remember the old sit-ins, but this is going to be a drive-in. They're going to shut down the Capitol. Shh, don't tell anybody. So this is a great time, gentlemen and ladies, for civil disobedience. We need to be the Rosa Parks here and protest against these government injustices.
Wait, did Great Value Ben Stein just call these idiots the Rosa Parks of COVID-19? Look, I know white people don't like to acknowledge black history, but nah, bruh. Segregation was not a social distancing initiative. When Rosa Parks was arrested for refusing to give her seat to a white man, the Montgomery bus boycott didn't cause widespread death and sickness, unless you count the white supremacists who were afraid that equality was a communicable disease. Now, I have no problems with white people gathering in protest because the freedom to assemble is a fundamental right of every American. I look at this the same way I view anti-vaxxers. If you'd rather die than adhere to the only scientifically proven way of fighting a global pandemic, be my guest. I've stood against a lot of white things. Mass incarceration, the war on drugs, people who take their shoes off on airplanes, but I am wholeheartedly in favor of white people spreading their germs amongst each other. That's why it don't bother me when they don't wash their legs. More washcloths for us. But don't equate your greed-inspired, selfish economic anxiety to the selfless acts of an American icon. The civil rights revolutionaries weren't risking their lives simply to secure the bag. So keep Rosa Parks' name out of your mouth. There's only one thing that you white Tea Partiers have in common with her. Y'all all need to go sit down somewhere. And it wasn't just the anti-science MASA movement whose stupidity made headlines this week.
If you know the song, sing along. Yeah, you're right. I think you're wrong in the high. I think you're wrong in the high. I think you're wrong in the high. Look at the white dude. Look at the white dude.
I'm sorry. My producer must have pulled the wrong clip. I asked him to pull a clip of Surgeon General Jerome Adams. As part of the Trump administration's COVID-19 task force, Adams, the nation's highest, medical authority, remember that, initially said this about the coronavirus.
Now, what we also want communities to know is that if you are a child or young adult, you're more likely to die from the flu if you get it than you are to die from coronavirus. So there's something about being young that is protective.
Now, Jerome, to be fair, there was a very popular opinion at the beginning of this global pandemic. It's true that more people die from the flu every year than coronavirus. You want to know why? Because there is a flu vaccine. Come on, Jerome. You got to stop spreading misinformation about the coronavirus by parroting the Trump administration's talking points. Like this, okay.
Let me ask the uncomfortable question of deadliness. How deadly is it really?
First of all, it's important to know that more people have died of opioid overdoses in this country in the last 4 hours than have died from coronavirus in this country this year.
Anybody right now and yesterday, anybody that needs a test gets a test. They're there. They have the tests. And the tests are beautiful. Anybody that needs a test gets a test.
And the one thing that I've heard, I've been to Georgia, I've been to Florida, I've been to Connecticut in the past week, is that no public health doctor who has asked for a test has not been able to get a test.
You lying, Rome. But I ain't blaming you completely, because I know a lot of people who initially said the same thing about coronavirus, like Hotep Bitcoiner Boyce Watkins, who said this.
The entire country shut down. The stock market's lost trillions of dollars. And I still haven't seen a single celebrity with the coronavirus.
But Jerome, you know the difference between Boyce Watkins and you? He isn't the chief medical official of the United States. Remember you said this about opening up the country?
Is the worst of this still ahead of us?
Well, again, it depends on where you are. We're hopeful that next week New York will start to come down because, again, their cases have started to level off.
While that sounds reminiscent of Donald Trump's stance on opening up the country, you said that damn near a month ago on March 27th. But you know what? That's not what made me decide to clap back at you, Romy. The straw that broke the camel's back was when you decided to address COVID-19's disproportionate infection and death rates by offering this bit of advice to Black and Hispanic people.
You are not helpless, and it's even more important that in communities of color, we adhere to the task force guidelines to slow the spread. Stay at home if possible. If you must go out, maintain 6 feet of distance between you and everyone else, and wear a mask if you're going to be within 6 feet of others. Wash your hands more often than you ever dreamed possible. Avoid alcohol, tobacco, and drugs. We need you to do this, if not for yourself, then for your abuela. Do it for your granddaddy. Do it for your big mama. Do it for your pop-pop.
Jerome, what are you doing? You're a doctor. Now, I thought the first rule of medicine and Coronavirus Fight Club was to first do no harm. I didn't think the Hippocratic Oath meant you literally had to be a hypocrite. And I know you've since apologized, kinda, for saying something so stupid. And I know people have criticized you for stereotyping Black people and Latino people. I usually say Latinx, but I didn't want them to think that I was talking about the Hispanic X-Men. And I know everyone dragged you for perpetuating harmful and reductive stereotypes, but I got a different bone to pick with you, Jerome. Why you gotta lie, Rome?
You ain't got to lie.
According to the 2018 survey by the Substance Abuse and Mental Health Services Administration, the official and the biggest health and mental health survey in America, whites use illegal drugs more than any other racial or ethnic demographic, and they binge drink more than Blacks, and statistically at the exact same level as Hispanics. The Kaiser Foundation reports that Blacks and whites smoke cigarettes at the same rates, while the Hispanic population smokes at much lower rates. So your big mama and your pop-pop must have been at a potluck or a supper. Y'all know white people have supper, right? Because in spite of the popular narrative, it's white people who are doing the drugs. It's white people who are importing drugs. It's white people who are selling the drugs. We just get arrested at 3 times the rate of white people who use drugs at the same rate or more than we do. But I know you work for an administration where facts don't matter. That's why there is only one Jerome Black America will ever acknowledge.
Now, Jerome, yes.
O-E-O-E-O. Finally, we should address the elephant in the room. No, not the deltas. As you can see, we still have some kinks to iron out of the show. But there's another elephant in the room. Yes, this week's clap in the face is at the white supremacists targeting Black America. Yeah, this is for you, COVID-19, with your racist ass. Hey, now before I begin, I know y'all wondering, like, why I decided that coronavirus is white. I mean, come on now, y'all. I mean, y'all know coronaviruses aren't black. I'll admit, first I was kind of thrown off too because a scientist said that a coronavirus was a cousin of H1N1, and I know white people don't have cousins, but then I realized it was a metaphor. Plus, you kind of gave it away when you were on a cruise ship to Asia. I'm not saying that black people don't like cruises, but you came to America on the Diamond Princess, which coincidentally will be the third most popular name for black girls next year after Quarantina and Keisha. There's always like 1,000 Keishas. Anyway, yeah, I know you're white, coronavirus. The first place you went when you got here was all the places white people would go. You know, Washington State, not the DC one, the California coast, Rand Paul's house. But what I need to know is, why are you so racist?
72% of our deaths here in Chicago residents have been in Black Chicagoans, though again, Black Chicagoans just make up 30% of the city's population.
There are now more than 17,000 cases in Michigan, and by far the hardest hit city is Detroit, accounting for nearly half of the state's more than 700 deaths.
A troubling racial impact. An Associated Press analysis of nearly 3,300 coronavirus patients who died found 42% of them were African American. Blacks only make up about 21% of the total population in that study.
COVID. You know, journalists and health professionals have bent over backwards trying to explain why you're going around America stabbing black people in the chest. Now, some have said it was population density. And yeah, black people do tend to live in metropolitan areas, which is why the word urban has become synonymous with black. But that don't fully explain the issue. For instance, when USA Today ranked the states in order of coronavirus deaths, New York and New Jersey, of course, they ranked number 1 and 2. And the most populous states were among the hardest hit areas. But I, along with many other black journalists, have been pushing for state health departments to disaggregate the COVID-19 data by race. We need to see this. But the CDC, the states, and the media are all misreporting the coronavirus data in another big way. They're reporting the infections as whole numbers. So the most populous states are always going to have the most cases, but they should tell us the testing, infection, and death rates per capita. I want to know how many people you're killing per 100,000 citizens. Now, when I looked at the places on your Kill the Black People tour, I realized that it wasn't just big cities. Hey, why is Albany, Georgia, the hardest hit city in America when you adjust for population? Why is Greensburg, Indiana, number 3? And Thomaston, Georgia, like when I was in grad school, my 1992 Nissan Sentra blew a head gasket in Thomaston. And when I asked people if they knew a good mechanic in town, they said, "Oh, you mean James?" They only had one mechanic. What are you doing there? Wait, I see why Albany, Georgia is ranked number 1. 72% black. In fact, when I look at the list, there are only 2 majority white cities in the top 10, and one of them, Thomaston, is still disproportionately black. I see what you're doing. Now, I bet you're asking, why is this important? And what does this have to do with racism? Well, Corona the Killer, people say you're killing black people because we already have health disparities. So, to explain that theory, let me show you this. Now, see how my pinky finger is a little crooked? That's from a fall I had when I was 11 years old that never healed properly. And that one year, I was in the hospital all the time. I sprained my wrist dunking on Roger Ferguson in Monty Tony's Milk Crate basketball goal. I got a concussion falling off the monkey bars playing King of the Mountain. I had food poisoning. I fell out of a magnolia tree and had to get stitches in my leg. And then there was the tummy ache. I mean, my stomach always hurt. My mom told me it was because I ate too many bologna sandwiches, so I ate less, but my stomach still hurt. Then I tried a low-fat diet. It was a thing back then. Nothing. I took Pepto-Bismol, castor oil, anointing oil, and you gotta try the blood of Jesus, right? But nothing, still nothing worked. I would take a couple of Tylenol or aspirin like I did when I broke my hand, or dunking on Monty Tony's milk crate basketball goal. I mean, it was a beautiful dunk, y'all. I mean, it was real pretty. One night, it got so bad that I went to the hospital again. They had me take this white substance called a barium swallow. It looked like a milkshake, and it essentially coats the stomach and the intestinal tract with a substance that shows up on x-rays, highlighting any problem areas. Now, the reason it can do that is because barium is slightly radioactive. In small doses, it won't hurt you. But if you take enough, you'll get diarrhea, then you'll start vomiting, then it paralyzes your muscles, and then it paralyzes your heart. I mean, it is a muscle. Now, I just had a cup. And then they found out that I had a slight peptic ulcer, which is caused by smoking, drinking, and too much alcohol and stress. Now, unlike Jerome Adams' Pop, I rarely drank or smoke, and I didn't have much to worry about because, again, I mean, I was 11 years old. So they couldn't figure it out. They couldn't figure out why I had this peptic ulcer. And a few days later, my regular pediatrician, Dr. Coward, a saint of a man, he called me in. And he looked at how many times I'd been to the hospital. He looked at those little charts, that's in metal things. And he asked my mom what she giving me for my sprained wrist. My mom, who don't trust white folks' medicine other than Dr. Coward's, said she gave me aspirin and Tylenol. That's all I've been taking. She gave me the same thing for the broken finger. It's also what I took for the concussion. She used Tylenol to break the fever when I had food poisoning. I took one or two, maybe, whenever my stomach hurt. In fact, if anything ever hurt, the only medicine I was allowed to take was aspirin, Tylenol, or again, of course, the blood of Jesus. Now, it turned out that the ibuprofen or the aspirin was eating the lining of my stomach, giving me an ulcer. The brilliant Dr. Coward had figured out what had been making me sick. Being sick. Now, the Arizona Republic says you're killing black people because we're disproportionately poor, which is true for every dollar an equally educated white person earns, even when they adjust for years of experience. Black people are more likely to have asthma, hypertension, diabetes, and almost every other health problem that exacerbates COVID-19. A Johns Hopkins study showed that black people are twice as likely to live in a healthcare desert. That's what they call it. It's a zip code where there are no primary care physicians. Black people are less likely to have health insurance, a nearby grocery store, or the ability to pay out-of-pocket expenses. Black neighborhoods are less likely to have clean air, which essentially means that white lungs literally get more oxygen when a white person inhales. And did you know, a survey of medical students showed that an astounding number of doctors believe that black people have thicker skin and can stand more pain than white people. This is white supremacy. It doesn't have anything to do with swastikas or Confederate statues. White supremacy is institutional. It exists regardless of animus or hate. If every white person started loving black people today, it wouldn't mean shit if they didn't work their damnedest to dismantle inequality in America. But Corona, that don't explain why you're killing black people. See, even the obesity numbers aren't as disproportionate as the coronavirus death rates. The disparity between hypertension, diabetes, asthma, and poverty still don't match how many black people you're killing. And no one knows why, except for one person. No, not me. See, Dr. Coward figured it out. See, Tenderone, it's not your fault. It's America's. You're this nation's barium milkshake. Of course, you are a poison if we take too much of you, and you are just a thing this country has swallowed, and you're exposing where the problems are. You don't cause these problems. You're not even what ails us. See, white supremacy is the sickness, and it's also what's making us sick. The sickness is making us sick, and as murderous as you may seem, you have revealed one silver lining. See, we don't need no medicine. We just got to stop making ourselves sick. Tell that to your big mama and your papa. May the clapback be with you all. Amen.
Just received in our, this is the latest dispatch just received in our newsroom.